I'm very excited to share the data that we have had. This is an experience since we launched the Corvis in 2011 that we have recently introduced the integration with the Pentacam and Corvis. This provides us a very objective analysis using artificial intelligence to integrate the data from tomography and biomechanics, the corneal deformation response, which is very important so that we understand IOP, so that we can combine the data to improve optimization for keratoconus and ectasia detection. When we screen for a refractive patient, we need to understand if the patient can have the procedure safely. So we need to understand ectasia risk. A few years ago, we understood the concept of going beyond topography to detect keratoconus mild cases. Of course, we need to detect both, but we have to enhance the detection and the characterization of ectasia susceptibility. So the predisposition of each cornea has to undergo ectasia, to have biomechanical decomposition. And this ectasia can happen in any cornea, so that we have to understand how we can do the procedure to the cornea and the cornea will be stable in the long term. Corneal biomechanics is very important for many areas, and definitely the first one is glaucoma assessment. It's not only IOP, it's glaucoma assessment. The same way we talk about ectasia predisposition, there are characteristics of the cornea that are definitely related to the risk of glaucoma progression. I'm talking about corneal and nerve interactions. So it's very important that we go beyond and we understand IOP better, and definitely we understand glaucoma assessments in a different domain. Well, we are combining data. We have a multi-centered effort that we integrated data from many centers. We started the TBI with Brazil and Italy populations. Now we have populations from many countries, India, China, Japan, US, many countries that have contributed with this data. So we have a very large data. We have a big data analysis so that we have the ability to first validate the random forest leave-one-out cross-validation that we have developed for the TBI. Second, we definitely have an opportunity to improve it, to further improve what is already very good. So the TBI is ready for us to use in the clinical setting. I use it every day. It's the most important part of the assessment for ectasia risk that I see. And it's definitely going to get even better than what we have today with artificial intelligence. So we have to understand how artificial intelligence can help us, and that's something that we'll see in our daily lives more and more with the technology coming into this integration.